Budget 2018 is also a plan that respects the choice that Canadians made just a little over 2 years ago.
He promised that this year's deficit would only be $6 billion. It is 300% higher than that.
And on pharmacare, what the government's proposing is not a plan. This is a fantasy.
Some of the reaction to Bill Morneau's third budget delivered this past week. This budget is the first to be done using gender-based analysis, and it lists a number of initiatives aimed at improving gender equality in the workforce. There's a promise of pay equity legislation covering federally regulated workers. There's also a few details, though, and no dollar figure attached. An extra 5 weeks of paternal leave, ostensibly aimed at allowing women to return to work sooner, and some money to boost the number of women in the trades and to support women-led businesses. The budget also featured that announcement about the pharmacare plan, or is it a strategy? We'll get to that strategy, rather. Is that something we'll get to in a moment? But let's get back to the Sunday Scrum. Joining me, Susan Riley, John Ibbotson in Ottawa, and Adrian Batra in Toronto. Okay, let's talk about gender equality from the Liberals recently. Lots of talk. Does the budget put its money where their mouths are? Adrian.
Well, their budget puts our money where their mouths are, that's for sure. Look, it all sounds nice. They're great words on a page. I have a hard time really genuinely understanding what it actually all means. We know that this Prime Minister and his government have decided that this is through this gender equity lens they want to look at things through. But I'll be quite candid with you. There's a lot of women that I talk to, and none of them are saying to me, or really at all, that they need the federal Liberal budget or the government to come in and rescue them from whatever they feel is wrong. I mean, I get that governments are, want to play a role in our lives, too much of a role in my view. This government in particular really feels invested, that they want to help with something. Talking about $1.5 billion for women entrepreneurs is great. Talking about getting more women in STEM is great. But I'm very, very challenged and troubled by the long-term debt we're being saddled with, because realistically, you're helping women maybe today, but for the women of future generations, you've given them a big bill to pay. And will those programs be there for them or not? I doubt it.
Susan, we know you've got some thoughts on this.
Yeah, I'm not sure. It's basically virtue signaling, I think, the whole gender equity piece. And I think it will win them, favorable attention in some circles. It seems to be aimed more at, women with higher incomes and with career aspirations. And, if it helps some, great. But it really, it's very mild. I don't think it's terribly well financed. The major problem is the lack of childcare for a lot of women. And that has been dealt with in previous budgets, but it's still, the supply is still nowhere near meeting the need. I mean, it's a joint federal-provincial responsibility, I guess. I think even on, I'm not sure that it was very, that it has much impact. And may I say, the other thing that they left out entirely, as I mentioned before, was a lot of those Sears pensioners, many of them women. And there are a lot of constituencies, a lot of women that will not be helped at all by this budget.
John?
Let me look purely at the political optics of it, because there was a poll this week last week from Ipsos, which showed Ipsos has been showing the Liberals pretty much where they were on election day, and the Conservatives pretty much where they were on election day, ever since election day. And for the first time, Ipsos has the numbers flipping, with the Conservatives actually moving ahead of the Liberals. Is it because of the trip to India? Probably. But look at this budget. This budget is all about helping women, and as Susan points out, more affluent professional women. It's about helping Indigenous Canadians, and that's great. Again, there are measures for the environment. But what is there for the suburban commuter? And what is there to counter the possible threat of a trade war with the United States? There's nothing there. The risk that the Liberals put themselves at right now, just in terms of partisan politics, is being perceived to be favoring this disadvantaged group and that disadvantaged group, but not favoring the people that they claim to be dedicated to, the sort of the broad suburban middle class voters who decide who gets elected. It is in fact a potentially dangerous path that they're on.
Okay, let's move on to pharmacare. Advocates were stoked on Tuesday by Morneau's mention of a national pharmacare plan, but by Wednesday, that plan had become, quote, a strategy. Take a listen.
We need to consider how we can best make use of our existing system, which, after all, for most people in this room is probably working, but recognize that there are very significant gaps that we need to deal with. So you said a national pharmacare strategy, not a national pharmacare plan. Those are two very different things.
Yeah.
We recognize that we need a strategy to deal with the fact that not everyone has access, and we need to do it in a way that's responsible.
So they're going to not only have a strategy, but study a strategy effectively. One advocate group called the change in semantics, quote, a cruel sleight of hand. Susan, start off.
I think that is the kind of poison pill within this budget. I think, in fact, most of the budget is fairly bulletproof, and you could tell that by how token the Conservative criticisms were of the budget. The NDP really have something to run on with this pharmacare thing, though. This was Bill Morneau stepping up and saying, you know, what you imagine was promised, which will be access to free drugs for most Canadians, is not going to happen. We're going to maybe, you know, plug some gaps. We're going to help the most poor with drugs, but to buy drugs, but we're not doing anything near what is needed or the promise. And it really reminds me also of the electoral reform piece, you know, where they are setting off on this nationwide consultation, but they already know what outcome they want. So why bother? Why spend the money?
As you say, Susan, potentially a gift to the opposition. Let's listen to MP Don Davies as he talks about pharmacare and the last time, or rather the first time this was mentioned and how long ago it was. Let's have a listen.
Honourable Member for Vancouver Kingsway.
Mr. Speaker, quote, many Canadians have limited prescription drug coverage and 12% have no coverage at all. This situation is plainly inconsistent with the values upon which Medicare is based. It is illogical to guarantee access to medical diagnosis, but not the treatment, nor does it make economic sense. Together with key partners, a new Liberal government will develop a national plan and timetable for introducing universal public coverage. What am I quoting, Mr. Speaker? The 1997 Liberal plan. Liberals failed Canadians then. Why should we believe them now?
So there it is, quoting from over 20 years ago, Liberal election promises then. John, pick up the thread from here.
Yeah, well, the problem, of course, is that pharmacare is very, very expensive. The idea that you would replace the private insurance industry with a nationalized, socialized pharmacare system is, I think, just not on. It would be hugely expensive, and we can't afford it. So what Bill Morneau is signaling is he wants to identify the gap between those who, like I suspect the people on this panel, who have drug plans through their employer. At the one end, those who are receiving government assistance at the other end because they're very low income. He wants to identify the gap in between, this maybe the self-employed worker, and find out, or someone who doesn't have drug benefits in their job, and find out who they are and how much it would cost to give them some assistance. And I suspect that they will try to move in that direction, but it will be not too high cost, because there's just not money in the kitty for anything that's high cost. And the really important question is going to be, is it something they put in the next budget, or is it something they put in the next election platform? But clearly it seems to me that this is all a lead up to yet another Liberal pharmacare pledge as part of its election platform 20 years after the first one.
Yeah, the Liberals aren't going to run on this budget. They might on the next one. Adrian, what are your thoughts?
Well, I guess we could call it one of those Liberal aspirational goals. But let's just talk about the politics of it for a moment. Ontario, the province of Ontario's former health minister, Dr. Eric Hoskins, was very quickly tapped to come and do this strategy, white paper, analysis, whatever the government wants to call it today, to come up with a plan, the framework. I mean, how many adjectives can I use to say that something's never really going to happen? They're just going to come up with some really important report that might sit on a shelf and collect dust. But so the Liberals in Ontario took the idea basically from the NDP in Ontario to provide free prescription services to those, I believe it's under 25 or 21 here in Ontario. Very expensive program, but the Liberals took that away from the NDP. So now if we're looking at the federal election in 2019, this is one more piece that the Libs are going to take away from the NDP. And the only thing that the NDP has to hammer them on is that the fact that there's no meat on the bone, so to speak. There's not an actual plan put in place. It's just simply necessarily, you know, a discussion and a framework or plan to have a plan. So from that perspective, the politics are interesting on this. Not necessarily putting the Conservatives in the best position other than to hammer away on the money. The parliamentary budget officer did say it was about $19 billion for a national pharmacare strategy. But I would suggest they look out west to my home province of Saskatchewan, where the former premier, now Brad Wall, did commit to a very significant drug prescription program for seniors and low-income people that seems to be working. Not ideal. None of these are ideal. But there are places that we can look around that we don't have to reinvent the wheel when it comes to this sort of thing, if you agree with a national pharmacare strategy.